Hello, everyone. It is 11 o'clock, so we will go ahead and get started here. Thank you for joining us today. My name is Jennifer Zodi, and I'm the Clinical Review Manager at Mountain Pacific, and I will be leading you through this training that is geared towards our out-of-state inpatient reviews. Also with us today is Stephanie Wilson from Telegen. So if there's anything that I'm not sure of, we will ask for her input as well, because she is much more the system expert for Qualitrac than I am. Today we're going to walk through how to utilize the provider portal for out-of-state reviews. And so we are focused specifically for out-of-state providers, meaning our Montana Medicaid providers that are outside of the state of Montana that do inpatient hospital admissions. So there are some different things that pertain to their way that they submit reviews and complete things in the system, say to like if it's a DME provider. So if there is anybody on the line that does not deal with hospital admissions, you're more than welcome to stay and listen, but please know that not all of this presentation today is going to pertain to you. We did do a general training back in March when we first transitioned to Qualitrac, and that is posted to our website. So if you're needing a refresher on how to submit requests, then that would be a great option for you to refer to, because I am going to go through that section fairly quickly today and just kind of hit on some of the areas that we've noticed that some providers are potentially struggling with. So if you do have any questions along the way, please use the chat feature. We will be monitoring that. And then at the end of the presentation, we will go back and answer all of those questions to the best of our ability. All right. So our agenda today, this is what we're looking at covering. Again, we will be recording this. This will be posted to our website. So you can either refer back to the PowerPoint or you can listen to the recorded video, and that'll be available as soon as we can get that posted there. So we'll start out on just a quick refresher on how to submit an out-of-state inpatient review. This is very similar to what we talked about in March and is just kind of a step-by-step. So again, I'm just going to go kind of a high level so we can get through this and get to some more of the other areas that we've noticed some potential issues with. So the provider portal is a web-based application. It allows providers to submit the requests online. The bookmark here, the website here is where we would request that you bookmark so that you can refer back to our portal page quickly and easily. If you haven't already filled out a security administrator packet for your facility, then that would be something separate. Hopefully most of you, because you are already signed up users, we can skip past that. You'll see when we go to the next slide that the login link is on the top right corner of the web page, and we do also provide other information on our web page around education and trainings. We have frequently asked questions, and then we have our contact information. So this is our web page for our portal. This is where, if you bookmark the site from the previous slide, this is where it will take you. The portal sign-in is on the top right. The other important thing to note is right below that portal sign-in is a link that says, does a code require a prior auth? So for inpatient hospital admissions, we're not required, or we don't review a specific procedure code, but let's say somebody's being admitted for a specific procedure and you're wondering if that actual code needs a prior auth. You can click on that link there and it will actually let you put in that code and tell you yes or no, so then you don't have to waste your time actually filling in the entire request just to find out that that code did not need it. That usually doesn't pertain to the inpatient admissions, but I just wanted to point that out in case you're wondering about an actual procedure code. Once we post this to our website, it'll be under the Education and Training tab. Again, just a brief reminder that if for some reason you've forgotten your password or you need to reset it, you're able to do that yourself. So when you click the portal sign-in button from the last screen, it'll take you here. You can click the reset password link, and then it will walk you through how to do that. But again, don't bookmark this page, because then when you go to log in the next time, you might have some issues actually getting into the portal. If you click that reset password, this will pop up. You'll enter in your username, which will then find what your email address is that's associated to your account and send you a link so you can reset your password on your own. This is the provider portal landing page. As we had discussed back in March, we primarily deal with the utilization management, so you would focus on that side of the screen. Up at the top is the menu bar. Again, the Qualitrac logo, if you click on that, it'll take you back to the landing page here. So if you're ever kind of lost and wondering where you're at, you can click that and it'll get you kind of back to the home. The magnifying glass is where you can search. You can either do a member search or a case-specific search. And then the little person-looking icon is where you can go in and manage your profile. So if your work number changes or your email address changes at your facility, then you can go in and update that information yourself. Under the utilization management icon, there's the Start Task button and the Search button. These are the two main buttons that you will want to use when you're going in and utilizing the portal. The Start Task button will take you to the task queue, which is where, as we'll discuss later, if there's a request for information or a discharge info task, those will be listed in that task queue. So that's an important button to know to use if you're going in for one of those purposes. The search button, just like the magnifying glass at the top of the page in the menu bar, is going to allow you to then search for a member or a case. So if you were to click on that search button, then it will let you search for a member. So this would be if you're starting a brand new request and you don't have a case ID already and you're starting from scratch. So when you click on the search button, it's going to bring you here to a member search. As the external user, you have to enter in the Medicaid ID number as well as the date of birth. And both of those have to match up against the eligibility file that we have loaded in the system in order to be able to pull somebody up. So both of those fields are required. Once you enter in, one other thing on the member ID, all of Montana Medicaid member IDs start with 2 zeros. And sometimes when you put the 2 zeros in front of them, it'll tell you that there's no result found, and I don't know why it does that. But if you remove the 2 zeros, then sometimes that'll help find that member. So if you try it with the zeros and it doesn't work, try it without the zeros also. If it works and you put in the member ID and the date of birth and it hits on a person, then it will list it here. You're able to click on any of those blue links. That's going to then take you into the member's information. So any of those links will work and will take you to the same place. So adding a new review, again, I'm going to try and go through this fairly quickly just because, and I'll primarily focus on some of the areas where we're noticing some issues. But when you click on the member, it takes you into the member hub. In here, this is where you're able to view any information on this member that is visible to your facility. So if a different facility has entered a case, you would not be able to see that. You're only going to be able to see information that pertains to your facility. If there is nothing listed or has been started on the member, as in this situation on the screen that you see, it says no data available. So that tells us that we have not received any request from your facility on this member. If you want to see more of the member details, you can click on the member details button. So back on this slide over on the right hand side, you'll see the button that says view member details, and then it just expands, and then you'd be able to see any additional information that we have available to us from the eligibility file. And then if you want to see even more, you can click at the bottom of that, or then if you want to hide that and go back to the original view, then you would click the hide member details button. Once you're here and you start to enter a review, you would click the add button. One thing that I would suggest and what we have noticed is that checking here and making sure that there isn't already a case started. We have had situations where potentially a prospective case gets entered into the system, and then maybe the admission date ends up changing, and in that case, if it's already been entered and it's already been approved, then you would just need to make a phone call to us to let us know that that admission date had changed, so that we can go in and modify that date, so then you're not having to re-enter a whole nother case. In this situation, the screen is showing that there's no requests that have been submitted, so then you would just click the add button to go ahead and add that. From here, the first panel you'll fill out is the authorization request. This really then drives the rest of the panels that are required to be filled out. The date and time will auto-populate for you. The review type, these are the different review types that are available. Again, today we're focusing on the facilities that are outside of the state of Montana. So you guys would be picking that out-of-state inpatient when you're requesting an inpatient admission. And then from there, that'll then drive your choices for place of service, type of service, and timing. The timing, a prospective case is going to be anybody who has not been admitted to the facility yet and services have not been provided. So that's going to be for dates in the future. Concurrent stays are going to be if the member is currently in the facility. So if they were admitted yesterday and you're just entering the case today, then you would pick concurrent because they are already in the hospital. Continued stay, we'll talk about that a little bit later, but that's to be able to extend the authorization for that member stay, whether it's a prospective or a concurrent. It can't be the first request that's entered. There has to be a prospective or a concurrent already in the system and approved for you to be able to do a continued stay. And then a retrospective is going to be if the member has already been admitted and discharged before you submit the request to us. And this might happen, you know, if they have retro eligibility or if they were only in for, say, 2 days and you're notifying us on the 3rd day, something like that. But most often we usually see the prospective and the concurrent stays. The other thing I just wanted to point out on the previous slide is once you have made all those selections and you add the request, this panel will be locked down and you'll not be able to change these options. So if you do, for some reason, maybe pick the wrong timing and you've already added it, you would then have to delete it and start over. So you really want to make sure that these 5 things are filled out correctly. All right, so the first panel is going to be the admission and the discharge panel. Enter in the admission date, the type, the source. If it's a retrospective case, it'll also ask for the discharge information or the discharge date. The coverage panel, this is where we have seen some issues where providers tend to get stuck or users get stuck, because when they get to the coverage panel, they'll see this banner that says member not eligible. And what's happening there is the system is looking at the admission date that you entered and it's trying to compare it against the eligibility file. And so Montana Medicaid typically does their their authorizations for or eligibility for services a month at a time. So everybody will show that they have Medicaid, for example, through the end of November. If you have somebody who's going to be admitted on December 10th, it's looking at, well, I can't see that they have eligibility on the 10th, so it's going to give you this banner. Other possibilities when this banner might show up is in this case, on the screenshot where it shows that they have Medicare or potentially a third-party liability. Knowing that Medicaid is payer of last resort, it's hitting off of those different things. So it's really just based off of, it's trying to think for us and say, well, hey, the data service doesn't seem to jive with the eligibility file. It's not a stopping feature. You would just simply need to go down to the bottom of the screen where it says eligibility comment and just type something in there. It doesn't have to be anything elaborate. It can be as simple as current eligibility or verified eligibility. As soon as you enter a comment into that box, it will then let you move on with the review. So don't let that member eligibility banner kind of scare you and think that you can't move further, because you can. So again, just making sure that you put the comment in there, and as soon as you put the comment in there, then you'll be able to move on. The next panel, this one is fairly new, a new look, I should say, within the last few weeks. They did some updates and kind of combined the providers so that you now have a copy feature, so you don't necessarily have to go in and do the search every time for each one of these. But for an inpatient admission, all three providers are required. So you're going to be putting in the treating physician, the treating facility, and the ordering provider. So knowing that that treating physician and that ordering provider might be the same, that's where you would be able to copy, and we'll look at that in a couple slides. But when you go to add, you'll click the add button, which will then take you to a search box. What I've found on this search screen is less is better. So the easiest is if you have the NPI number, enter in that NPI number and search just with the NPI number. One thing that we have found, there are some organizations who have one NPI number, but then will have multiple provider ID numbers attached to that NPI number. So for example, a hospital might have a provider ID for their inpatient hospital. They might also have a provider ID for, maybe they're also a DME supplier. They could also have a provider ID for an ambulance service. And all three of those provider IDs will be attached to the same NPI number. So if you enter in just the NPI number and hit search, when you get to the next screen here, you would actually see that NPI number listed multiple times. And in that NPI column, you would see that it's the same NPI number. But in that other ID column, now what you will see is the different provider IDs. And so that will help you to narrow down which provider ID that you need to pick. We have had situations where the right NPI number is picked, but it's attached to the wrong provider number. So then when the facility went to bill, it got denied because it had the wrong provider ID number on it. So then we have to go in and fix that. So if you know that your facility's NPI number has multiple provider numbers, when you're at the search screen, if you enter in the NPI number, and then if you know what your inpatient provider number is, enter that in the other ID box and then search with just those two numbers in there. And when you do that, when you get to this screen, you should then only have one option. But if you're searching by just the NPI number, or if you're not sure what the NPI number is and you're just searching by their name, then you potentially will get multiple choices at this spot. So just make sure you're checking that other ID and that it is the right provider ID. And then when you find the correct one, you'll hit the green plus, and then it adds it, it'll add it to the case. And so then you see here that it'll take you back out to that main page. It's now added that provider. And if you, for some reason, did choose the wrong one, you can click the remove button, then start all over and add it again. So this is where if you click the add button on the ordering provider, you'll see the new option of maybe it is different. And so you're going to add another new one that's going to be different. But if it's the same as the treating physician, you can just select copy treating physician, and it will then copy that there. So it'll save you time and you don't have to go back in through the search screen. And then you'll have to enter the treating facility as well. The next panel is the provider organization visibility panel. This is very important to make sure that you are selecting your facility in this drop-down list, because this is what allows it to be shared with everybody at your organization. If you get to this panel and as the user, if you don't select something in this drop-down panel, you will be the only one at your facility that can see the case. So you have to make sure that from that drop down, you're selecting it. If you're only signed up with one facility, you'll only have your facility as an option, but we do have some who potentially work at multiple, and so they might have multiple options there to pick that they can select from. But usually it will just default to the one facility that you're associated with. So just make sure that you pick that so that then everybody will be able to view it. These I'm going to go through fairly quickly. Again, this is just a review from the March of going in and adding the diagnosis. Again, click the add button. You can enter as many as you need. You can drag and drop them if you add them in the wrong order. When you click on that add button, it'll take you in here. You can search by code or term. If you do need to add more than one, once you find it, you'll select the radial button to the left. If you need more than one, you can say submit and add another, or if you're only adding one, you'll just hit submit. Diagnosis then will load back out to that main page. Again, if you pick the wrong one, you'll have a trash can. You can delete it and start over. Procedures. For inpatient admissions, the system will default the procedure tab to this code. Please, please, please do not add any other procedures here or change this. It defaults to show 1 day, but the nurse reviewer, when she does her review and based on criteria and the average length of stay, will make that determination as to how many days will actually be approved. So you don't need to go in and change this. This defaults so that it saves you time, so that really you can just kind of skip past that procedure panel. So please just leave that, and then after you do your diagnosis, you can scroll past your procedures and it's done for you. Documentation, this will be the final panel that you have to submit. You click the add button to attach any of the clinical documentation that is needed for the review. When you click that add button, it'll bring you to this panel, and this is where you can either drag and drop your file, or you can click the button and then pick from a file that's in one of your folders on your computer. A couple things to just keep in mind. Requirements for when you're uploading a file: it must be in PDF or Word document or format. It cannot have any special characters in the file name except for like an underscore. So just please don't use any special characters. And the file name can be changed, but if the original one that you upload had special characters in it, you'll get an error message. So just keep that in mind. And then the other thing is that the document has to be less than or equal to 300 megabytes. So if your file is larger than that, you'll have to break it up and upload more than one file. Then you'll have to select what kind of category it is. Typically it's clinical, then topic will pop up, and then you can further define what that is. Once you've done all that, you'll click the upload button and it'll take you back out to the main page. You'll see that it was added to there. You can always click under name, that where it's in blue is actually a link. So you can click on that to assure that it is attached there and you can open it and see it. If you have to add more, you can click your add button, or if you accidentally added the wrong one, you can use the trash can and start over as well. Once you've done that, you'll hit the continue button. It'll take you to the attestation page where you'll enter in your username and then click submit. The comments box will pop up. This is optional. You don't have to enter anything in the comments box, but if there is something you just wanted to relay to the nurse reviewer, you can put a note in there, and then that'll be submitted with the case as well. And then you'll hit submit here, and that is what will then finally send the case to us for review. After you hit that submit button, you'll be taken back to kind of a summary of the review. You can look it over one more time. If you find you made a mistake, you can edit it. If you somehow get through all of that and realize you completely entered it in error or it was the wrong member or whatever, you can delete it. Or then you can just leave that review and go back out either to the task queue, or you can go to the search screen if you need to enter someone else. So searching for a request. After you've submitted that review, you can find it by searching by the case ID. So the case ID will be emailed to the user who submitted the case, but it's also on the case. When you get taken back to that summary page, it'll be at the very top, so you'll know what the case ID is. So then you can search by that when you're in that search using that magnifying glass or the search button. If you're in the UM panel, you can look at the member hub, and in the member hub is where you will be able to review to see if any determinations have been made. You can start a continued stay review, which we'll go over, or again, you can delete a review if it was submitted incorrectly. So we've already kind of talked about the case search, but if you're coming in again, the two ways to do a case search is either on the menu bar using the magnifying glass and select case search, or under the utilization management icon and click the search button. When you click on that, it'll take you to the case search. In the case ID box, that is where you would enter in that case ID. You hit search, and then again, it will pull back anything that it locates. And so it'll be listed down there. Again, you can click on any of those blue links, and it will then take you to a summary of that case. If you want to see the determination when you're in the review summary, you will scroll down to the outcomes panel and click on the dark brown line. By clicking on that dark brown line, it will then expand, and you'll be able to then see what you had submitted as requested, and then the panel right next to it is the final recommendation. So right now it's defaulted to the requested. You can see where the word requested is. It's kind of a darker gray panel, so you know that that's what you're looking at. And then if you want to look at the final recommendation, you would then click on that, and then it will update that information there as well. The other way to see the determination is if you scroll all the way down to the bottom of the case, and under the correspondence panel will be the letter attached. And when you open that letter, then it'll have the information on there as well, saying if it was approved and for how long and when that the next continued stay review would be done if they don't discharge. So when you're in that case and the review summary, and you've looked at it and you want to go back to the member hub, then up on the top left there, what they call the kind of breadcrumb trail, you can click on member hub. A box will pop up and say, do you really want to leave the screen? And you would say yes, and then it will take you into the member hub. And here in the utilization management panel, it'll show you again any cases. So earlier the example we showed said that there were no cases in there, and now you can see that it would show the case that had been entered. You're able to see the status of it. You're able to see the request start date. So this is where if you see one in there with a request start date and that has changed, if they originally were supposed to be admitted on, say, November 30th, and now they're going to be admitted on December 10th, this is where you could place a call to us and we could update that for you. In this situation, a review has not, or the outcome has not been decided yet, and so that's why the outcome underneath that is blank. But then from here at the member hub, under the action column, the blue ellipsis there, if you click on that, you can either view the request, or if a decision has not been rendered and the nurse has not started the review, you could also delete it if for some reason it was submitted in error and wasn't caused or found sooner. Once the review is completed, then under that outcome column, you'd be able to see either approved, denied, partial denial, or a technical denial for what that decision was. And then you'd have to go into the case to actually see the specifics on it. Continued stay review submission. So this is where we have been noticing some confusion as to how to maybe do these or when to do these. And so again, this would be if you have submitted a prospective or a concurrent review. You would go into that member hub, and over in that ellipsis on the right-hand side is where you would select a continued stay review. The purpose of the continued stay review is to request additional days for that member if they're still in the hospital beyond what the original authorization approved. And the CSRs are submitted, you would continue to do that until the member has actually been discharged. So some people might not have any, and some people might have multiple continued stay reviews. One of the big things is to not be entering a continued stay review until the actual due date. When the initial one is done or reviewed, it will say on there when the continued stay review is due. So if it says that the continued stay review is due on the 25th, you would not want to start a new review or a continued stay review in the system until the 25th. Anything sooner than that, those days have already been approved, so it's not really necessary. And when that gets submitted in this example on the 25th, we would then need that newest documentation to verify that they really do still need to be in the facility. And we'll talk about RFIs later, but also you don't want to do a continued stay review if you're just simply responding to a request for information. So this is, again, we've approved an initial date span and you're needing more days added to that. So when you're at that member hub, when you click on that ellipsis on the right-hand side, you will see that option for a continued stay review. When you select that, then this will pop up and ask if you really do want to extend your request, and you're just going to simply hit the green button and say request extension. So by doing that, it's going to then, the system's going to copy forward all of that previous information, so you don't have to re-enter anything. It's going to copy that forward. It's going to then allow you to attach additional clinical documentation, which is required when you submit a CSR. And then that will then submit to us, and so that we can complete that review. And again, you would continue to do this until that member gets discharged. So a request for information, another area that we've had some confusion around is, I guess, really how to find the request for information. So if we start a case and we identify that additional clinical documentation is needed before we can make a determination, we will generate an RFI, or a request for information letter, on the case. What that does is the system then sends an email back to the user that submitted the case asking for that additional documentation. The email will be sent, and then you will have to go log back into the portal, go into the case, go down to the correspondence section and open the letter to see what additional information is required. But to get there, when you log into the portal at the Utilization Management screen, instead of using the search button, now you want to use the Start Task button, because the Start Task, again, is going to take you to that task queue where you'll be able to see the request. So when you click on the Start Task button, this is where it will take you. This is the scheduled task. Any requests for informations that are sent back to you or discharge info tasks are going to be located on this screen. So you may have multiple on this screen for different members if you have more than one Montana Medicaid member in your facility at the same time. One of the things that we have found, I actually had a call from a user who was here, but she said, I can't see anything. There's nothing showing up. All I see is these 3 blue dots over on the left-hand side. So right up here on the right-hand side, right now, I believe it says 9 columns selected. So this, if you click on that when you're in this screen, there's, I think, like 14 different columns that are available with different types of information. So in this view, there's 9 that are selected. It's user specific, so I can set it up to look one way for how I want to see things when I log in. Someone else can set it up and have different columns selected. What we had found out was that when the person called, that said 0 columns selected. So they actually they weren't showing any of the data, so they couldn't see anything. So as soon as I had her, select those columns, and then she could see that information across there. So if anybody goes in here and all you're seeing is the 3 blue dots, that's probably why. So make sure that you've got columns selected so you can see the data. So on this case, to start this, you're going to click on that ellipsis, and then a drop down will pop up and you will select Start. When you do that, it's going to take you into the case. You'll want to scroll down, as I said, to the correspondence section. Click on the Request for Information letter. That will open. You'll be able to see that information. Then once you're able to gather the information, you would scroll back up on that same page. You'll scroll back up to the documentation panel, click the Add button, and go through the steps to add the documentation. If the original user is not the one who needs to be submitting the documentation, then they need to forward that email to whomever so that they know that that request for information is out there. Regardless of who the task is assigned to, anybody in the facility can start or complete the task. So just make sure that the correct person that needs to be doing it knows that that is out there so that they can get that information submitted to us. Once you add that documentation, you'll scroll back down to the bottom of the page, click the Done button, and then that finalizes it and sends it back to us and lets us know that you have added that documentation. When you're done doing that, you'll go back out to that scheduled task queue where you'll notice that that request for information task will no longer be visible on your screen. You may still have other tasks listed. Again, we'll talk about the discharge info tasks, or maybe there's other members who we have a request for information on, but the one for that specific person will be gone. Another important thing is please do not start a whole new review to submit that additional documentation. Really, it just delays the process. It kind of muddies the water, and then we're not sure, is that really a new request? Is this part of the old request? So then it takes a lot of kind of investigating, potentially calls to your facility to figure out what is going on and how to do that. The other thing is, if you get a request for information, you have to go through that task. You have to start the task and attach it that way. If you just search the case and attach documentation and you don't go through the request for information task, it's not going to come back to us, and we're not going to know that you've attached that documentation. So we're not going to get any kind of alert that we need to go back in and complete our review. So very, very important that if there is a request for information, you must go through the scheduled task queue and start the task for that person so that it does the proper notifications, and then we will know to start it. So the discharge status task, this is the last unique feature for all our inpatient admissions. Whenever we get a case for an inpatient admission and we complete that initial review, the system is going to automatically create a discharge status task like shown here, and it's going to again assign it back to whoever that original user was. So this will be in that scheduled queue, and it's there so that when the member does discharge, you're able to go in and enter in that final information. Again, just like a request for information, anyone in the facility can start or complete the task. But I mean, if you're not planning on completing it, I would suggest not starting the task. In the past, it did cause some issues, but now it should be fine. But really, if you're just wanting to go look at the case, you should then just go through the search and use the case ID and search that way, not start a task unless you're actually planning on completing it. So again, here, just like a request for information, you would want to click on that ellipsis to the left. You'll get a drop-down box. You'll click the start button, and then it's going to take you into that task. So there's kind of the three main things that we're needing from the discharge status task. The discharge info, which includes has the member left the hospital, what the discharge date is, and the discharge disposition. What is the final diagnosis? And then any final documentation such as the discharge instructions or the dictated discharge summary. So at this point, all discharge information should be going through the portal and should be completed by the facility. Please do not submit these to us via fax. In the beginning, we were having some issues with this and it wasn't working correctly, but that has been fixed and is working. And so this really is a very important step for the facility to complete. And the reason for that is the system creates the prior auth number from the very beginning, and it's on the case. However, that number does not transmit for payment until this task is completed by the facility. So even though you have a prior authorization number, if this step is missed and you guys then just go to bill with that prior auth number, it will pay, but it's only going to pay at the 50%. Because we've not transmitted the authorization number yet, it's not going to know that it's an approved case in the system. So this is the screenshot of the information that will need to be filled in. Again, on the diagnosis, you'll just want to go to that final diagnosis if there's more than one and click the radial button for whichever one the final diagnosis is. Add your documentation and then complete it. Another suggestion is to not use the authorization number as a reference number. So if you're calling us, it's easier to use the case ID number. We had found in a couple situations where the facility was using an authorization number as the reference number, but because one of the continued stay reviews were not completed yet, the person who didn't enter the request at the facility couldn't see it yet. But as soon as they searched by the case ID, they were able to see everything. So just, again, just a kind of a tidbit, use that case ID number as your reference number, not the authorization number. The other thing about the discharge task is before you complete it, you need to make sure that all of your days have been approved. So if you go into the member hub and you can see that the last request approved the stay through the 20th, and it's now the 24th and they're discharging. If you don't have an approved review for all of those dates of service, if you complete the discharge task, it's only going to transmit the last day that was actually approved, not the actual discharge date. So then we can run into issues with that as well. So one of the important steps is When you go in to do the discharge task, go in and make sure that you have approvals for your entire length of stay. And as long as you have all of those days approved, or maybe if we authorize, say, through the 20th, but they're discharging the 18th, you're still fine. All of your days would be covered. Then when you enter in your discharge information, if we did approve you through the 20th, but they actually discharged on the 18th, then it's going to transmit the 18th as that last day. So then it'll match up when you guys do your claim. Earlier, I've kind of referenced that there's email notifications that go out. When do those email notifications go out? That'll happen when a review is received from the portal. So as soon as you enter and complete a request, you'll get a notification that lets you know that that case was submitted. Anytime the status changes, you will get a notification for that, and that includes a request for information, and that email will specifically say it's been identified that there's additional documentation required, so you'll know that that is a request for information that's needed for that. The email is sent to that person who submitted the request. So if you are the one who submitted the request and you're not the one that you know, needs to follow up and it's somebody else, you can forward that email. The emails do not contain PHI, so it is just the case ID. Because email is not HIPAA compliant, we do not include any PHI in those. So you will have the case ID. You'll be able to then go in, you'll know what case we're emailing you about. You'll be able to go into the portal, search by that case ID, or go into your task queue and find the request for information task that'll be there. So again, the website, as I mentioned earlier, I would highly suggest that this is the site that you bookmark so that it's easier to access. And then if you do have any technical issues, if you're having trouble logging in or you're getting error messages, you can call our IT department, press option 2, and they will try to help you figure out what is going on and get a solution taken care of. For the actual hospitals, if it's more around the, like I said, you've already submitted a request, but now you need to change the date of service, maybe the discharge date was entered incorrectly, whatever, and we're having to maybe do some of those changes, then you can use that 800 number. Statuses, you can check in the portal yourselves. You can get the auth number, like I said, out of the case. So all of those calls that you used to have to make to us, you now have kind of at your fingertips. When you log into the portal, you'll have that information there. All right, well, we will go to the chat session and see if anybody has any questions here that I can try to clarify for you.
So Jennifer, the first question comes in from Amy, and it says, do we use the portal for child adolescent patients in inpatient or residential? We had been told not to use it previously.
So I believe that that is the new work that Mountain Pacific and Telegen are taking on, which will be coming January 1st. There are trainings that are scheduled specific to the behavioral health and mental health work that is coming over to us, and those are in December. So as of right now, those are not coming into the portal, but they will be.
And that is the only question we have so far. If anybody has any other questions, please feel free to put them into the chat window and we'll make sure we get them answered. Oh, Stacy asked if they can get a copy of the presentation emailed to them so they may train other team members.
It will be on our website. We'll post it there, so you can go to our the website here, and it'll be under the education and training. So you'll have free access to it. You can print it off and use it at your leisure. And
then Julie asks, if additional info is is needed regarding a CSR request, who is notified? The original person or the person who submitted the CSR?
And Stephanie, I'm going to default to you on that one.
Okay. So if a prior auth or concurrent is submitted by a user, that user would get the request for the additional information. If a different user submits the continued stay review following that prospective or concurrent review, the person that submitted the CSR is the one who would get the request or the notification for the additional info request. So it's the person who actually submits that review through the system is the one who gets the notification email. And if a different person submits the original and then the first CSR, and then another person submits the second CSR, whoever submitted that one is the one who would get the email notification letting them know that they need additional information for that review. Next question is from Chelsea. Does adult inpatient mental health currently go through the portal?
Yes, adult inpatient hospitalizations are currently going through the portal. That's the one piece of behavioral health that we were doing previously and is not part of the new work that's coming over. That's work we've already had. So I believe on that, you would still select, I'm going to scroll back up here in the, so I'm using the right terminology. So the place of service, I believe, then says inpatient. Psychiatric, is that right, Stephanie?
Yes, yep.
Okay. So yeah, so you still pick out-of-state inpatient, but then your place of service would specify that it's a psychiatric hospital.
For urgent emergent admits, if they are OBS stay, is PA required? Is that obstetrics, OBS?
Can you repeat that?
Yep, for urgent or emergent admits, if they are OBS stay, is PA required?
So if OBS, if they're meaning observation.
Okay.
If it's observation, no, not until they convert to inpatient, if that's what they mean by OBS.
If the patient changes, so they added onto their question, it says also if patient changes, do we contact? Is that
yes, so if they start observation, they don't need to notify us of the observation, but if they convert to inpatient, then they would need to notify us that they have converted to inpatient. And that would then be the same process of going into the portal and submitting it.
Okay. Beth asks, I submitted a case a while ago and it was a partial denial for a simple billing mistake I made. I did send the bill to Medicaid and they refused payment. Should I resubmit a corrected request to the portal?
Anything that's a billing issue, I would recommend you get a hold of the claims specialist up at the department. And I apologize, I don't have that number right in front of me. If whoever submitted that question wants to email me, then I can look at it a little closer and then decide if that is something that needs to go to them or if there was something messed up in the case. But no, don't resubmit the case. We'll take a look at what was done in the system currently and how to move forward with that. Or you can call our UR department and we can help you with it.
We have a question from Tracy. It says, to clarify, if another person builds the case and then the hospital UR submits a new case, the hospital could delete the initial case. So yes, as long as everyone has access to that review in the portal, so everyone has access to that NBI and that review, and 2 identical cases are submitted by different departments or by different people, one of them could be deleted. That's correct.
As long as the first case has not already been reviewed
Started,
and completed.
reviewed. Yep.
Right. Because if the case has been completed on our end, then no, you're not able to delete it.
Yes. Good point. Sandra asks, what if they convert from inpatient to observation? Do you guys need to be notified, or does something need to be submitted?
Then I would say just have them call our UR department and we can look at the case and determine what needs to happen at that time.
And then Jennifer, can you flip back to the slide right before with the website up?
You bet.
Because someone is asking where they'll be able to find a copy of the webinar, and it will be posted to this www.mpqhf.org website. So you'll be able to find it there under the education and training.
Yep, and I'll go back up here. Whoop. So when you go to our portal page, it'll be here under the education and training tab.
The next question asks, can anyone looking under the start task see if a case needs additional information, or only the person who had initiated the review? Do you want me to take that one?
Yeah, please.
Okay, so yes, anyone that has access to the organization that was set in that provider visibility panel will be able to see the tasks that are in that task queue, and then anyone can be able to start those tasks and complete them. So as long as you have all your users set up under that organization, then yes, you can help each other with tasks. The person that it's assigned to does not have to complete it. It can be reassigned to someone else, or you can email them and let them know that it's out there, or someone else can pick that task up and complete it. Next question. I know you said no observation notification is required. Just want clarification if this rule applies for any observation stay regardless of the length of stay.
That is correct. If you're not billing it as an inpatient admission, then it does not require prior auth.
Next one is from Chelsea. She says, we are having problems with our provider ID number and the authorization not matching up when we go to bill. I'm wondering if we should just enter our MT provider ID number in the NPI spot, or what the best way to go about this would be. We aren't able to select any other option after entering the NPI number.
So I was just scrolling back down.
I think it just went past it.
I go past it. Oh, there it is. So this is where I was talking about, if you enter in your NPI number and the provider ID as the other ID, so the box right next to it, then it should only give you one option. It should only match up against that one. You can also, if you don't put the NPI number in there, you can also just put in your provider ID and search based on that as well. You can do any mix of these options. What I have found, and I'm not sure why, but it's almost like the more you fill in, either the longer it takes to come across it, or it might give you a user not found because maybe not every little thing matched up against it. So I wouldn't recommend filling in every single box here. So if you want to just put in your provider ID under that other ID number box and search based on that, you can try that, or do your NPI number and your provider ID and see if that will help you.
From Sandra, told in the past that RAVE department starts the case, that case manager would follow up with clinicals.
So that, yeah, I'm not sure what the question is.
So I think what they're asking, and please add more if this isn't right, but so there are times when a certain department will start a case, maybe if someone comes in through the emergency department or something like that. So they'll start to build that review in the system, but they won't complete it and submit it. And so what they'll do is let maybe their billing department or some other department know, medical records department, that the clinical documentation needs to be attached to that case, and they'll provide that case number to them. They can go into the portal as long as they have access, search for that case, and then upload the clinical documentation that needs to go with it, and then finalize the case and submit it for review. So you guys can have that process in your facility if that's what works best for you. You just need to make sure that all the different people have access to the organization and have the ability to log into the portal and submit the information.
Yeah, and if, you know, and if the case gets submitted and we happen to start it before the next department is able to attach the clinicals, that's when the RFI letter will go out or will get attached in the email notifications. So if, you know, if one department starts the case and submits it and the next department goes in and we've not started it yet, then they can still go in and attach the documentation before we even start the review. So it just depends on that timing, on if we happen to pick the case up before they're able to attach.
And that's all the questions that I'm seeing right now.
Okay. And Stephanie, I just had one for you, that we have been getting some calls where when that discharge info task is created, that it sounds like that it's sending an email asking for saying that they need information, but it's not an RFI. So it's been causing some confusion because that email goes out. And so I was just wondering, do you know anything about that?
I don't, but I can check. It would make sense to me that it would say that, because we are asking for additional information on the case, but it's not the request for additional information. So we may need to update that wording. So I can check on that.
Okay, great. Thank you.
And then we just had one more question come in. It says, we usually only have a treating provider NPI number with multiple locations. At one point, we were told to use the NPES as the correct provider on file. Is this still true? You guys should really only be able to see, if you're entering in a treating provider NPI, you shouldn't see NPES as an option. You should only see ones that are loaded from the file that we get from the state. So if you get a return for a provider or facility that has multiple addresses, it should ask you to select which address you want to use, and then you can select that and then go ahead and add the organization. But I will double check on that, because you should only be seeing options in the treating provider field from the provider file. Okay. Nothing else has popped up.
Okay, well, we are about 4 minutes past the hour, so I want to thank everybody who attended today. And like I said, we will get this recording posted to our website along with the PowerPoint, and would appreciate if there are others at your facility that were not able to join today to please pass the information along. And as always, if you have questions, please let us know. Thank you so much.